Hi everyone, I'm Dr. Angela. I'm here today with Antonia. She is currently over 40 weeks pregnant, but we're getting there. This is her second pregnancy with us, and today we're going to talk about the Webster Technique. Now, Antonia, do you want to explain a little bit about what brought you in for chiropractic care during your pregnancy?
I would say obviously back pain. I was having some lower back pain and then subsequently some pelvis pain. So
Want to get that worked out a little bit. And you have seen us through your first pregnancy, and this is now your second. How would you say that your first pregnancy, labor and delivery went?
It was pretty smooth early, and I kind of came every month for a while, then kind of ramped up some of my sessions as I got bigger, and everything was pretty easy and smooth.
Which is pretty incredible for a first pregnancy, because most of the time there's some slowness, sometimes you're late in delivery and all of that. One of the things that's great about the Webster Technique is that it is a specific chiropractic adjustment for the sacrum and for the pelvic structures surrounding the uterus, so that we decrease any torsion, and then the baby gets in the right position and is able to help with a smoother labor and delivery. It used to be known as a breech turning technique. It is not specifically for that purpose. It's different from an external version that a medical doctor or an obstetrician would perform for very specific reasons. We are just trying to create an environment for the baby to be able to turn on its own, and an external version is for sure manual manipulation of the baby, and we do not get involved in that. The success rate for the Webster Technique is far higher, and there is no risk to mom or baby during it. So what I'm going to do now is have you go ahead and lay down on the pillows, which help to support the belly. And I'm going to show you just the Webster Technique specifically. It is very, very important that we assess what's happening with the sacrum during the whole pregnancy, because the sacrum has attachments to the uterus. And if the uterus has a tight ligament to it, it is going to then cause some degree of torsion of that uterus and not allow for the baby to have enough room to get in a good position. So the first part is actually checking tension, seeing if there's tension on one side versus the other. And for her, it's more on her right side. The drop piece on our table is meant to help with an adjustment so that they don't feel the impact of it as much. It's all very safe and gentle. And we're going to just adjust that restricted joint on the right side. And then recheck to see that it has actually changed the tension a bit. And now she's more equal. So I'm going to have you flip onto your back, and we'll take the pillows out. The second part of the Webster Technique is going to be assessing the round ligaments. The round ligament is actually attached to the broad ligament on the uterus. So because that round ligament then connects down to the labial area or the front pelvis, there can be some tension that way too. Many pregnant women will get movement pain, so changing positions, you can get little twinges in the round ligaments. And if we actually put a little myofascial release in that area, it releases that ligament tension. Baby then can drop down or flip into the right position, and it allows for a much smoother birth. It can take from 30 to 90 seconds to get a ligament to release. Hers are pretty balanced because she's been doing this for a while now. One of the major issues that we have now with deliveries is something called dystocia. Dystocia is failure to progress. So when a woman goes into the hospital or to her birthing center and isn't progressing, dilating, and going down the normal route of care, they're going to start pushing more for a C-section or some kind of intervention, whether it's induction, Pitocin, those types of things. And the problem with that is that those interventions then can cause some problems with the baby in the future. So we want to have a healthy, safe birth, We want to make sure that we are doing the Webster Technique throughout pregnancy, not just when there's a malpresentation. Chiropractic care is absolutely safe and effective for all pregnant women as long as they've been to an OB and there's no structural risk factors that we would identify in a full exam. So we hope to see you soon and answer any questions that you might have. Bye, guys.